Thank you very much, Mr. Chairman and Ranking Member Collins, for having this hearing today. I am pleased to have the opportunity to introduce Dr. Robert Stern and Chris Nowinski, co-directors of the Boston University Center for the Study of Traumatic Encephalopathy. Dr. Stern is a professor of neurology and neurosurgery at Boston University School of Medicine, and he is the director of the clinical core of the Boston University Alzheimer's Disease Center. He received his undergraduate degree from Wesleyan University and his master's and doctoral degrees in clinical psychology from the University of Rhode Island. Before joining the Boston University School of Medicine, he served on the faculty of Brown Medical School and the University of North Carolina School of Medicine. Dr. Stern's research has led to more than 250 peer-reviewed publications and has helped us to better understand the effects of trauma and aging on the human brain. Now, he's here today with Mr. Nowinski, who is the co-founder and executive director of the Sports Legacy Institute. This is a nonprofit organization that's focused on addressing the issue of brain trauma through education, through policy, and through research. He received his undergraduate degree from Harvard University, where he played defensive tackle for the football team. And after college, Mr. Nowinski became a professional wrestler, and his own experience in that sport with head trauma led him to co-found the Sports Legacy Institute. He currently serves as an advisor on the NFL Players Association Mackey-White Traumatic Brain Injury Committee and the Ivy League Multi-Sport Concussion Committee. Chris has received numerous accolades, including the United States Sports Academy Distinguished Service Award for his work advocating for improving safety standards in sports. I am very pleased that Dr. Stern and Mr. Nowinski are here with us today. I know they will add enormously to our discussion, so thank you both. Research at places like Boston University that focus on traumatic brain injury has revealed that athletes and veterans with chronic traumatic encephalopathy, or CTE, exhibit structural changes to their brains that are similar to the patterns of brains for people with Alzheimer's disease, and that the patients exhibit similar symptoms. And I know we've been talking some about this, but I want to ask the question a little bit differently. We don't know the root causes of these conditions because not everyone with a history of head trauma develops CTE, and not everyone who develops Alzheimer's disease as they age. But we also currently lack effective diagnostic tools or treatments for either disease. So the question I'd like to ask for Dr. Stern and Dr. VanLandingham is, how can you use what you learn about traumatic brain injuries to inform the study of other age-related neurodegenerative diseases? Dr. Stern?
Senator Warren, thank you for that question. That is the question that led me to get involved in the study of chronic traumatic encephalopathy. As an Alzheimer's researcher, I was never really interested in traumatic brain injury, except one day I happened to be giving a lecture saying that traumatic brain injury was a risk factor for dementia, and Chris Nowinski's roommate was in the audience, and we then connected, and it led me to find out about what was a burgeoning topic of this chronic traumatic encephalopathy. And the reason why I got excited about it was just for that reason, that it is a close enough cousin to Alzheimer's and other diseases that had been studied, that we could exploit what we find out about one to learn about the other. Mm-hmm. And so with chronic traumatic encephalopathy, we know the necessary variable for developing this disease. The necessary variable is repetitive brain trauma. Right. That's, like you very articulately said, that is not the sufficient variable. Not everyone who hits their head is going to develop this disease. But we know that everyone who has this disease has had a history of repetitive brain trauma. Mm-hmm. By that nature, we're able to then look at a group of people at high risk, very high risk for developing this disease, and study them longitudinally and use new diagnostic tests to be able to detect when the disease might start, and then follow them till death and have my colleague Dr. McKee and other neuropathologists examine them. That's a very unique thing. In Alzheimer's disease, we don't have that ability. We don't know who's at very high risk for getting it until later on, when we might be able to do now a special kind of PET scan that can detect the amount of amyloid in their brain. Well, now we can use both sides of this picture to inform the other and make us get to answers so necessary in a much faster fashion.
Dr. VanLandingham, did you want to add anything to that?
Yeah, well, I'll just reiterate a little bit that no one brain is the same. One of the most common questions I get from parents are, well, when should I make my son or my daughter stop playing this sport? How many concussions? And I'm like, well, everybody's different. You'd like to say, well, after 3, they're predisposed to CTE. So it's a very complicated answer, but I agree with Dr. Stern that it is a special population that can be measured for many in the years to come, and you'll get closer to the right answer. I'd like to add one more comment to the Lou Gehrig's issue. I do a lot of preclinical research with animals, and we can give concussions, even one single concussion to an animal, and we find the tau protein in the cerebral spinal fluid. And that fluid not only bathes the brain, but also bathes the spinal cord. So it could be an issue of transferal from the brain that's been damaged of these pathological proteins down into the spinal canal in some level of fusion. But we don't know yet. But it is definitely bathing the spinal cord after a brain injury.
Well, your comments, both of you, Dr. Stern and Dr. VanLandingham, remind me that the wonderful thing about science is that discoveries don't occur in isolation, that what we learn by studying one disease can pay dividends in shedding light on other diseases. The director of the National Institute of Mental Health, Dr. Tom Insel, told the HELP committee last year that we are on the cusp of a revolution in brain research because of the incredible tools that are now available that hadn't been there before. And yet, at this critical moment, we're cutting back on NIH funding. Year after year, adjusted for biomedical inflation, NIH's budget has shrunk to the point that we are now investing less in research with NIH than we were in 2001. So let me ask the question this way. If we could double the budgets of your centers, what could you do and how much faster could you do it?
I'll go first.
You've got to show us the aspiration here, Dr. Stern.
With a doubled budget, we wouldn't just double the speed at which we could answer important questions. It would be an exponential increase.
Yeah.
One of the things that's been happening across the nation has been the loss of young investigators and senior investigators. Young investigators because there are no jobs for them because of NIH cuts. There are no jobs for young postdoctoral fellows or new researchers trying to get an assistant professorship. Senior investigators who have been working for decades are having to close their labs because for the first time ever, they have no funding. Because of that, we can't have continuity in research. We can't have the numbers of people to be able to focus on a particular question at any given time. So that's one of the starting points why we'd be able to have much faster answers is because if we had more money, we'd be able to have a real meaningful staff to answer the questions. But we'd also be able to do much more with technology. And that's what's so wonderful about doing this type of research in 2014. While Senator Warren was out, I was mentioning that just right now, this moment, we're putting one of our former NFL players in a PET scanner to be able to look at tau protein in their brain. It's the first time we're doing it. It's very exciting. By being able to have support for that, to double our budget, to be able to continue that research, not to close it down, we'd be able to diagnose CTE during life very, very accurately within the next 5 years.
That's amazing. Dr. VanLandingham?
So I'll start by saying that I work for two different nonprofit companies for a for-profit company, and I'm a professor at an academic institute. So there's various thoughts that go through my mind to answer this question. I think if we had funds from the federal government, let's say, that would sponsor private companies, that would be easier for private companies to get investors. It would improve the value to the investor by having federal government support. Now, that's a little out there. Big pharmaceutical companies don't do R&D anymore. Smaller companies are now the ones that have to go out there and either raise the money or fight for the grants just to be able to get this to a point where it can go into clinical trials. Professors in academic institutes have wonderful ideas, but they never, hardly ever try to commercialize them because they do not have the means in which to do that. Your question on how much money, doubling the budget, and for $20 million in a year, I could be in a phase 2 clinical trial for concussion, the first drug. If I had $20 million today, in a year I could have us in a phase 2 clinical trial.
Okay. I appreciate it. You know, we talk a lot on this committee, for example, about Alzheimer's. And the Alzheimer's Association says that as our nation continues to age, Alzheimer's disease is projected to cost our nation $1.2 trillion a year by 2050. Over and over, we understand the importance of research and ultimately the importance, not just for people's lives, but the importance in terms of how much money we have to spend to care for people. And so I just want to make it again clear. We cannot stand by and do nothing. We must increase our federal investment in medical research, not slash it. This is our only chance to bring costs in the future under control and to give people a better quality of life. So thank you very much for your work. Thank you so much for being here to raise awareness around this issue. And thank you, Mr. Chairman, for letting us go over.